Hello friends, couple of days back I posted few photos of my feeding plate case in a cleft lip and palate patient who was just 10 days old. So many of my friends were interested about knowing the case. Even my non-medico friends were curious about the case. So in this video I'm going to explain you about the condition that is cleft lip and palate, and the interesting part is I'm going to explain you about how I fabricated the feeding plate in that patient. So without any delay, let's get started. Cleft lip and palate is a common congenital malformation. The incidence of cleft lip and palate is 1 in 500 to 1 in 2500 live births. Cleft may occur as cleft lip with or without associated cleft palate or isolated cleft palate. Causes of these conditions are unknown, but mostly they are genetic in origin. However, there are certain risk factors associated with this condition. For example, smoking during pregnancy, obesity, diabetes, and older mother, and due to few medications that are not supposed to be taken during pregnancy, especially due to anti-seizure medications. Also, the condition can be diagnosed during the ultrasound examinations, that is anomaly scan, that is carried out during pregnancy. Embryologically, cleft lip results from the failed merging of maxillary and median nasal elevations of one or both sides due to inadequate migration of neural crest cells. Cleft palate results from failure of lateral palatine processes to meet and fuse with each other. Now, because of the cleft that is present, the baby will be having breathing difficulty, feeding difficulty. Whatever being fed to the baby, it will be regurgitated out of his nose because of the direct communication between his oral and nasal cavity due to the cleft present. Then speech abnormality, recurrent nasal as well as oral infections, dental problems. Later on, the patient can also develop hearing and as well as vision defects. Appearance of the baby may affect the mental health of baby as well as his or her parents also. So prenatal counseling in this particular condition is very important. There are various different classifications of cleft lip and palate, most popular being View's classification. In group 1, the defect involves soft palate only. In group 2, the defect involves hard and soft palate. In group 3, the defect involves from soft palate till alveolus involving lip also. And in group 4, there are complete bilateral clefts. Treatment of this condition is multidisciplinary. It requires a proper, thorough treatment plan. It requires involvement of prosthodontists, oral surgeons, orthodontists, speech therapists, and much more. Proper, successful cosmetic results can be obtained, but the treatment is lengthy one. Now about my role as a prosthodontist in a cleft lip and palate case. So, as soon as the baby is born, it is important to feed the patient. Till 9th or 10th day after his birth, baby is being fed with the nasogastric tube. But feeding with the nasogastric tube till longer time is not advisable. It may lead to infections. So from about 10th day after his birth, we can start the process of fabricating feeding plate. So here starts our role. Now I will show the demonstration of how I fabricated the feeding plate in my patient. I would like to mention that whatever video is being shown to you, the patient is being informed about the video and consent was taken for the video. Here is my 10 days old cute little patient with a cleft present unilaterally involving hard and soft palate, alveolus and lip. According to View's classification, it is grouped as group 3 type of case. For starting any procedure, we have to make sure that our working platform is very clean. We have to use clean bowl and drinking water for starting with the primary impression. Then we have to carry out proper hand washing, as we have to do the primary impression procedure barehandedly, as we have no clue about the patient if he is having latex allergy or not. So we have to do the procedure barehandedly. Primary impression is made in modeling wax. Take a small piece of modeling wax, heat it and mold it according to the shape of patient's arch. So this is our primary impression. Now on this impression we have to make a special tray using cold cure acrylic resin. Also make small holes on the special tray so that our condensation silicone can retain on it. I had used condensation silicone putty for final impression procedure. So mix the condensation silicone putty with catalyst and load it on the tray. Also place it in the patient's mouth. Keep on tapping on patient's feet so that he should cry and the defect can be accurately recorded. Check whether the condensation silicone is set properly. Gently remove the impression from patient's mouth. Here is the final impression, and here we can see the fine details are recorded in this impression. Now we have to pour this impression using dental stone, and I have poured it using reverse beading technique. This is my obtained final cast. Then I blocked all undesirable undercuts using modeling wax and applied separating medium. Then I fabricated feeding plate on the cast using cold cure clear acrylic. Then I did finishing and polishing using the polishing kit. Make sure that the borders of the feeding plate are not rough and they should be very polished so that it should not hurt the patient. After making sure the feeding plate is inserted in patient's mouth, and as shown in the video, you can clearly see that the patient have developed the sucking response. For holding the feeding plate, I have made a hole in it and tied a dental floss. In this clip you can clearly see that as soon as I inserted the feeding plate inside the patient's mouth, the patient stopped crying and started suckling reflex. He's sucking it continuously and now he's able to have his milk at ease without any regurgitation from nose. We just have to make sure that we have to hold the patient upright while feeding the milk. The plate should be used during feeding only, and whenever the plate is used in patient, make sure that you have washed the plate using the betadine liquid and drinking water. Also, we have to tell the patient to do proper hand washing before inserting plate in patient's mouth. As the little baby keeps on growing, patient can use this particular plate for just 2 or 3 months. So we have to recall the patient accordingly. So this is it, and I was really very happy after inserting the feeding plate in this little cute baby. I wish and pray for the early recovery of the baby, and I hope that this video must be informative for you all. Thank you so much.